So for folks who don't know, the Diaper Bank was established in 2004. So we're just coming up on our 20th anniversary, really in the hopes that not only do we provide diapers and other supplies, basic essentials for families, but also to raise awareness that so many are lacking in these really essential needs that are really helpful and necessary for the full functioning and bodily autonomy for folks. If you think about diapers for infants and toddlers, as well as period supplies, incontinence products for youth who need them, as well as incontinence products for adults who need them. In thinking about diapers in particular, and first, our goal is to ensure that families have the things that they need, including diapers, period supplies, and incontinence products, and also to really educate and advocate so that those things are considered essential basic health needs for families. And that no one should have to worry about these basic essentials across their lifespan. What we know about the issue of diaper need pre-COVID was that the stat was 1 in 3 families struggled to provide clean diapers for their baby. In 2023, there was the National Diaper Check, which the results were just released, that diaper need has actually significantly increased, that 1 in 2 families struggled to provide clean diapers for their baby. That the economic impacts that our families felt during COVID, that those haven't subsided or have been alleviated at this point, and many are less well off than before. When we think about a diaper, what seems like something that is so small can truly have a significant impact on the health and well-being of a whole family. If you think about the health of a child, of a baby, what seems like something as insignificant as diaper rash or diaper dermatitis, if left untreated or the conditions that cause it don't change, that can really turn into something much more significant that could lead a family to the ER. And then what that means is significantly more cost, time off for a parent, a copay, impacting the health and well-being of the child, but also the economic well-being of the family. And the health of mom, in 2013, researcher Dr. Megan Smith did a study around mental health in moms in New Haven. And what she found in her research was that diaper need was the #1 predictor of postpartum depressive symptoms in moms. And even we were shocked at that, having been distributing these items for so long. But if you think about what that means, is that families, and in the study, moms in particular, will face this stressor every few hours, conceivably, for over the course of between 2 and 3 years. And so if you think about that, and as a new mom, thinking that you're not able to provide this basic essential for your child certainly doesn't help empower you as a parent. We also know how much this impacts the economic security and success, that families are required to provide a supply of diapers to bring their child to childcare. And in an economic analysis study that we participated in 2018, and then a national version that was replicated over the past year, showed that families were missing about between 4 and 5 days of work a month because they couldn't bring their child to childcare, which for a family who's making minimum wage could equate to around $6,000 a year. So we know that this has a significant impact on families who need it the most. And then the link between not being able to bring your child to childcare and then having access to those quality early educational opportunities for families is another impact. And we know, again, everyone here has an understanding that those 0 to 3 years is such a critical time for growth of a young child and how much brain development and growth happens in those first 3 years. It's such a critical time. And we want to ensure that we are not only creating an environment where basic needs are met, but that we are ensuring that those basic needs are met. Again, just some of what I've highlighted already, that families need diapers to attend childcare with the potential impact on the achievement gap. They can't attend these programs unless they provide a clean supply of diapers. Another thing that we found through anecdotes over time from some of our providers, particularly those who are family childcare providers, is that many of those family childcare providers are key to a couple of things. One, they're providing care for infants. A lot of infant care is through family childcare providers. These small businesses, for the lowest income folks who are relying on subsidized slots or care, potentially through Care for Kids. What they may be faced with is either taking money out of their bottom line and providing diapers to a family who couldn't afford enough to change their child, or losing that subsidized slot. And so we have seen many family providers tell us that they were faced with paying these out of pocket before that they had a chance to partner with the diaper bank. So how does the diaper bank work? The distribution side of our work, which again is 1/3 of what we do, we collect funds and grants, federal, state dollars, individual donations to bulk purchase diapers, which come to us in a truckload, and we can really use our purchasing power to get more diapers and make more resources available to families. We then deliver the diapers to organizations and partners throughout the state of Connecticut who are working with families with young children in need. And then those valued and trusted partners are distributing the diapers to the families. And that could be organizations like early care providers, which is the picture that you're seeing there, home visiting type programs, shelter-based programming, really a wide range, very intentionally, so that we ensure that folks get these products from partners that they trust in their community. Faith-based organizations as well are really a large partner of ours. We, over the past year and a half, have really looked for ways where we can increase our impact and ensure that even more families have access to diapers by creating partnerships with organizations who share our goal with wanting to make sure families have access. One of those is Diaper Connections, and that is a collaboration through the Diaper Bank of Connecticut and the Connecticut Hospital Association. And this was started with funding that was made available through COVID that the Diaper Bank of Connecticut applied for through a small city's COVID grant through housing. And what it does is it brings together all of the hospitals across Connecticut, their leadership, and also the folks who are working with families most directly to not only either distribute directly to families or partner with close partners in the community, but also as a way to collect data on both who is receiving diapers, but also the potential health-related outcomes based directly on hospital reported data on things like diaper dermatitis, UTIs, and other related health-related issues that can be connected to lack of access to diapers. And so we're really excited about not only the ability to distribute through these partners, but truly the ability to collect research and data to make an even stronger case for why this is so critically important. And there was a recent status report if I try to, which I will share with you. I think if I click the link, it will mess up my Zoom function, but basically this is our first report out showing that we've served over 2,200 children here, and that we're starting to get some of the health-related data, and that will be hopefully available very soon to share, so that we can truly connect that distribution to that change in that outcome and health data. The other significant thing that we're working on is, as an organization, becoming licensed to be reimbursed by Medicaid for the provision of incontinence products to youth and older adults who have Medicaid coverage. And what we hope to do a couple of things with that. One is that it's a source of revenue in a space that we're already in. So that does two things, really two core things. One, it helps us have a sustainable revenue stream to support folks who don't have coverage under Medicaid for these products, which are and have been identified as health needs for these special populations. But two, it also helps us further make the case for advocacy that diapers for infants and toddlers are similarly medical necessities for very young children as well. And so that's a process that we were awarded funding through the Viking Global Foundation to assist us in starting, and we've begun this process. And we're really excited about this work and our focus here, that we can hopefully have even a more significant impact on families. And then we are also working toward advocacy for, as I alluded to, expanded Medicaid coverage for diapers. And folks may have heard of the bill last year in the last legislative session. So there was initially a bill that just said diapers would be covered under Medicaid, which of course is quite a heavy and significant lift, and one that we recognized would need careful planning and thoughtful input on what that would mean to implement in a process at both the state and federal level. And so Representative Gilchrist led the charge to help us think about the legislation as a task force. The task force bill didn't make it all the way through session, but we actually didn't need a bill to create a task force. And so there is a health-related social needs task force that is looking at ways in which Medicaid can cover many different things. In particular, things that have been identified are around housing and food security are the sort of buckets that CMS has named as a priority. In our work on this group, one thing that we have worked toward and gotten some information on is that because diapers are already recognized as a medically necessary item in the CMS regulations, again, for these other populations, because of an incontinence or related medical diagnosis, there is a potential path that we are hoping we can work to create and implement that will help this specific population of infants and toddlers have that same coverage. So that is work that is ongoing, and hopefully there will be something good to report before session starts, I should say. We will at least have a recommendation from the task force, an actual work plan to see, in fact, how that would work. So we're really, truly excited about that. It's very, I'm sure some folks have an understanding, it's very in the weeds and technical. around how that process can be done. But we have, I think, the right people who are thinking this through. Folks from the Hospital Association, the former Medicaid director for the state of Connecticut, and several researchers and community partners who are really helping us think through how that would all work. So we're really excited about that work. And particularly its impact on families who need diapers. And that was the main thing that I wanted to talk about.
Tom, thank you so much for joining us this morning. Tom Fulton is a certified prevention specialist who graduated from UConn in 2017 with a bachelor's degree in cognitive science. He started in the prevention field working as a prevention corps service member with the Housatonic Valley Coalition against substance abuse. In 2018, he started working at the Wheeler Clinic as a resource specialist. His role has changed a few times over the past 5 years with Wheeler. He is currently a program manager and is mainly responsible for overseeing the Change the Script prescription drug misuse prevention program. We welcome Tom and thank him for joining the WSPIC group this morning. Go ahead, Tom, take it away.
Thank you, Sheila. Good morning, everyone. Just by a show of hands, how many of you are familiar with the Clearinghouse or Change the Script? You could do the emoji hands if you want to get fancy, or just physical hands is fine. Okay, so a decent amount of you, that's good. So for some of you, it might be a bit of a refresher, and for others, maybe you'll learn something new. So as Sheila mentioned, I work at the Connecticut Clearinghouse, which is a program of Wheeler Clinic. We are a specialized library and resource center that focuses on substance misuse, mental health, prevention, harm reduction, and health promotion, treatment and recovery, and wellness and other related topics. There's some information on how to get a hold of us, get in touch with us, our hours. So our services, we offer books, DVDs, that are available for loan 3 weeks at a time. You can always extend. Membership is free. There was a point in time where we charged for membership, but no longer. We do also have pamphlets, fact sheets, posters. I'll get into that in a little bit more detail. Also, our prevention listserv, which is basically an email listserv of over 2,500 prevention professionals that we share our own events and trainings, as well as other organization events and trainings. We do also host educational forums and other trainings. And we have our community resource van, basically to conduct direct outreach, set up tables, and provide educational information on substance misuse and mental health. Here's some different ways to access our materials. We have resources available online for download direct. You could also just browse our library catalog and order. We'll send it through the mail. You're more than welcome to stop by and pick up any of the time, Monday through Friday, 8:30 to 5. Yeah, or just give us a call. So here's some different pamphlet topics that are have been popular in the past year or so. Things like marijuana, vaping, harm reduction, and fentanyl. Also mental health, particularly in the wake of COVID, we have found that there's been more interest in things on mindfulness, emotional fitness. Some other poster favorites. We tend to be pretty popular with schools, I would say, but yeah, maybe your office or lobby could use some sprucing up. And yeah, these are all available for free, like I said. Also some different fact sheet topics. Xylazine, we have over 200 fact sheets. We research them fairly carefully using like reliable sources, FDA, DEA, CDC, and we try and compile it as best as we can all to one sheet. These are also available for download, or we can send them to you. Other evidence-based resources, we do tend to be fairly popular with social workers, or you know, particularly students. Just sometimes we have textbooks available for free. You know, you can save a little bit on cost. And then just other resources. That one actually in the bottom left, we do distribute for free It's for adolescents, maybe early adolescence. And it's all about mindfulness, different emotions, and how to cope with them. We do distribute those through our community resource van, which I'll mention a little bit more in detail later. We do also offer training monthly, sometimes even twice monthly. We recently had a QPR training, so we have a master trainer on staff here, Heather Klinger, who can train people in also becoming a trainer of QPR. If you're not familiar with QPR, it's question, persuade, refer. It's a suicide prevention training. I believe their motto is kind of similar to like CPR, in which anyone can apply the principles of QPR. So yeah, they refer to it as being a QPR gatekeeper. We do also offer mental health first aid trainings, youth mental health first aid trainings, assist trainings, which is also a suicide prevention training, but it goes a little bit more in detail. I believe it's 2 8-hour days. So yeah, feel free to reach out to us, and maybe we can coordinate days that would work, or we do send out regular updates of when we do have upcoming training. Also in the past, we have done adolescent screening, brief intervention, and referral to treatment trainings, which is essentially, there is some brain science and just how substances affect the developing brain, but also it gets into using the expert screening tool when working with adolescents and basically screening their past year substance use and determining their level of risk, and then kind of working on next steps, whatever they may be. So we do also have our prevention listserv, which I mentioned earlier. Essentially, we can send out email blasts that are relevant, related to substance use and mental health. Here's some examples of things that we might send out. Our newsletter goes a little bit more in depth than our prevention listserv. We kind of tailor it, focus it a little bit more on our own services and what we're providing, or other kind of upcoming notable events. So Change the Script is really the program that I mostly oversee. It's a prescription drug misuse prevention program. Kind of the core tenets of it are safe use, safe disposal, safe storage, and also making people aware of naloxone, and now actually even providing access to naloxone free of charge, which, if you're not familiar, another name for naloxone is Narcan, and it's the opioid overdose reversal drug. It works as a nasal spray. We also do touch on alternative pain management options and kind of making people aware that there are voluntary non-opioid documents that you can provide to your doctor that basically say, I'm not interested in being prescribed opioids. What are my other options? So we do also have our community resource van. It's been up and running for about 3 years now, actually. We'll go to farmers markets, wellness fairs. We've been to yard goats games, high school sports championship games, really anywhere in the state at absolutely no cost. And we will bring some of our mental health and substance use related materials. And actually now we have some new offerings. This is just kind of showing that we go rain or shine, lots of different places. Sometimes maybe the rain or even, I guess, the snow might be too much and we might not be able to do it, but yeah, we do our best. So we do actually also offer other harm reduction materials. This is sort of a newer development for us. We have always done, if you see the Diaper and the medication lockboxes there, those have always been part of our offering. So that's to dispose of medications that are expired or left over, or safely secure them just so that they don't get into the wrong hands. Like maybe if people have young ones in the home and they don't want them to have access to their medications. But also more recently, we have received approval to start distributing Narcan nasal spray, which I mentioned earlier, as well as fentanyl test strips and xylazine test strips, so people can test their drug supply. We do also have a website, drugfreect.org. On the website, there is additional information on opioids as well as other substances. We do also have an online order form, so you can order the large Diaper medication disposal pouches and the medication lock boxes free of charge. We'll send them anywhere in the state. We do have to put limits on these things just because we do offer statewide and we want to ensure an equitable distribution of those items. And we do also have other print materials that are available on there for order. A year or so ago, we had a pretty big push with the Recovery Friendly Workplace Initiative. So we were trying to raise awareness among employers and employees really about their options for becoming recovery friendly, what that looks like, and kind of the benefits of that as well. So another aspect to change the script is our media campaign. We do broad advertising, billboards. We did have kind of those specialized advertising things that you see on the left at Yard Goats games, digital, through social media, buses, transit. We also did direct mail to workplaces. We focused on building industry and food service industry. Just we found that there were higher rates of substance use and even opioid use among those professions. So we kind of wanted to target them. So yeah, this is kind of some small examples of what our media campaign has offered. We do also make creative samples available online on our website, Drug Free CT, so people can, if they have like state opioid response funding, let's say, they can use our messaging and branding for their own purposes and their own communities. And that is all I have. Feel free to scan the QR code if you'd like. It sends you to our Change the Script specific page on Drug Free CT. And there's my email. So if you have any questions about anything that I've mentioned, feel free to reach out.
Christy, thank you for joining us this morning. Christy Knowles is a licensed clinical social worker at the Department of Mental Health and Addiction Services as the Opioid Service Project Lead at the Office of the Commissioner, the WSPIC Group, Department of Mental Health and Addiction Services, and the Connecticut Women's Consortium welcomes you, Christy. Thank you for joining us.
Hello, everyone. Good morning. I will share my screen. So yes, my name is Christy Knowles, Opioid Services Project Lead here at DMHAS. And so today I was just going to talk to you about some of the services that our particular team provides here in the state of Connecticut. So here is our team. We have Louisa Barnett, who is our Director of Opioid Services, Justin, our Service Coordinator, and myself. We are a small but mighty team. So I figure I'd give a little bit of an overview in terms of how we're able to provide funding for and where it comes from for all the services that we provide. We had started out in 2016 with about $3 million from SAMHSA, and since then we have definitely expanded. We're currently receiving $14 million per year. Unfortunately, part of that is due to the increase in overdoses that we are having currently in Connecticut and throughout the United States. We also have our COSUP grant, which provides another $6 million. So that is Comprehensive Opioid Stimulant and Substance Use Site-Based Program, hence why we love all of our acronyms. And that one is a deflection program that McCall and Liberations have, where they're able to go out with first responders after an overdose or for high-risk individuals in the community, and they're able to provide services to those families and their loved ones. And what makes it a little different is that it has a database component to it. So the police will go out based on a call, and they're able to, through an encrypted system, send a message to the overdose team, and then they're able to go out and also track that client for up to however long they choose to. So now we're starting to be able to really gather more data in terms of referrals made, interactions with the same people, naloxone distributed, things like that. So with the money that we receive from our state opioid response, we've kind of put it into different buckets. Much like Tom had mentioned around prevention, which is really important, and along with recovery support, harm reduction, and evidence-based treatment. So in order to be successful with trying to combat the opioid crisis, it's really important, as we all know, is to collaborate with other state agencies and programs. And so here are a list of all the different agencies that we interact with and support each other in trying to work together to decrease these numbers. So taking a step back, I thought it would be helpful to look at some of the OCME data that we have. And this is coming from DPH data report. So as you can see, in 2021, we had 1,531 confirmed overdose deaths. And last year, we had 1,464, which is about a 4.4 reduction. And according to the numbers this year, we're looking at another close to, hopefully, fingers crossed, another 4.4 reduction. So we're hopeful that all the work that everyone's doing on this call and beyond is really having an impact on the communities that we service. Obviously, our hope is that these numbers would go down even more, but we're happy to see that it's in a positive trend. So of those deaths in 2022, 85% of which had a fentanyl analog involved with it, and 24% involved xylazine. Males had a higher mortality rate than females, and a big piece as well that we've been working on is around 60% of those who died in a residence. So I think those are really important because unfortunately there's a lot of stigma where people think that those that have these issues are out in the community, they're on the streets and they, aren't employed, they aren't living at home, that they're, and it's really happening in our homes. And so we're putting a lot of effort along with Change the Script and others is to really understand that it could be your neighbor, it could be your child, it could be your cousin, and to really get the word out and what that looks like and how to help. So in terms of our priorities, our top priority is naloxone, all things naloxone. Really trying to get it out to as many people as we can has been a big priority because we know that has an immediate impact on those and it saves lives. So we give out free naloxone to people throughout the state in hopes that it will get into the right hands. And I'll talk more about that. Treatment, recovery supports, outreach and engagement, overdose prevention, harm reduction, all the things. So here is our naloxone saturation plan. So I am the lead in terms of naloxone, so I'm the go-to person and you will have my information. So if you are looking for naloxone for your program, you can reach out to me and I can either, depending if we have an account, get it delivered to your agency or we can meet in the community and I can get those kits for you. We provide them to the RBHAOs, parole, correction, so that when they leave incarceration, they do have a kit with them because we know that's a high risk time. We also are giving it with the Department of Public Health. So on the vans, like we'll talk about, all DMHAS facilities, all the EDs get their naloxone from us. And we also are working with first responders. We recently just got an influx for the first time from the state of Connecticut for $500,000 to be able to purchase naloxone kits to be able to provide those to first responders in every city and town in Connecticut, which I have now found out we have 169 municipalities in Connecticut. And I'm coordinating with first responders to ensure that everyone has kits. It's based on population size. So some of the smaller cities are getting 12 kits and the largest cities are getting 540 kits to be able to share with those in the community. So here we have a breakdown in terms of the naloxone distributed by DMHAS. We have corrections and pharmacy. I will note now that corrections is now we give to corrections now. So in 2023, those numbers will be combined. And we are hopeful that with naloxone now being over the counter, we are hearing that pharmacy sales are also increasing so that people have access easier to those. But we're also understanding that not everyone can afford naloxone, even if it is over the counter. There are some copays for private insurance, but Medicaid clients can pick it up for free. So we are still willing to help and support in providing those kits to those who can't afford. So in terms of treatment, some of the programs that we support through our SOAR grant is outpatient levels of care. We have our clinic-based MAT program where we pay for the recovery coaching that's connected to those services. We have several of those throughout the state. And we also have our enhanced MAT, which incorporates recovery coaching and employment services to help support in finding not only resume writing, but going out and doing mock interviews and finding providers, employers that are willing to provide that employment. And helping with the medication, methadone, buprenorphine, and naltrexone. Wanted to just add the link to the addiction bed availability website, where you're able to see that in real time or as close to. And our access line, which is answered 24/7. They can be screened and help to identify the best provider, and transportation can also be provided if necessary. Next, we have our recovery coaching. So these are all of our recovery support, like bucket items. We have how can we help, our harm reduction drop-in centers, mobile employment as well, and some housing vouchers and Women's Reach. So I know we were talking about the syringe services. Here are 5 of the mobile MAT vans that we provide funding for. The Village is also another one. We just don't fund that particular one, so that's why it's not included on here. But we definitely support in getting their information out. So these vans are able to go out in the community, and they cover the state in their different areas. They provide naloxone, syringes, safe sex kits, really safe smoking kits, and they're able to provide wound care that is often connected with xylazine. They have information about referrals, so if a person does want to either get inducted onto MOUD or is looking for basic needs or any type of services, they're able to make those referrals as well. No medications are on the vans, but they are able to provide information in those other needed supplies. Next, we have the Monty Breakthrough. This particular group, they are in New Haven, New Britain, Waterbury, and Hartford, and they provide services to the Black and Latino community. They identify specifically those because they are most at risk for overdoses and have higher rates than our non-Hispanic populations. So they are utilizing faith-based services and recovery support to be able to help. There's about, depending on which program, about 18 weeks of coaching. They meet at a church. They're able to support one another, and they have a graduation at the end, which I've gone to, and it's really amazing. lots of positive outcomes coming here. We also have How Can We Help, which is very similar to the COSA grant that we had mentioned. It's going out to support individuals post-overdose with health departments, first responders, recovery coaches, navigators, faith-based community, their group, and they go out and help to support in meeting the client where they're at and literally saying, how can we help you? How can we help in this moment? What do you need? No judgments. How can we support you? The caveat is it doesn't have that data component, and the COSA is a pilot program, so it's something we're looking at and whether or not it's feasible to make it statewide. Our mobile employment services, we have in several cities here, again, where they're going out helping to get resumes out, interview skills, and finding actual employers. A new one that we have is peer navigators. So this one has just started. We have one site in the north, which is through CHR, and one in the south, which is through BH Care. This is another pilot project that was a result of the latest legislation. And this is where we are looking for peer navigators to go out in the community to find those that aren't involved in any type of services. Really going out and looking at meeting people at encampments, looking at soup kitchens, looking wherever we can to try to help those people, get them connected to services, give them naloxone, try to educate family members about services, and really hoping to address any social determinants of health that might be preventing them from seeking out care. So as of now, that's brand new. So they haven't, they're still in the hiring process. Our hope is, because that's a 2-year grant, that we're hoping that that will get off and start running quickly. We also have our family support groups. So Tri-Circle Support is a grief support group. They hold their meetings both, it's a hybrid, you can do virtually or in person. Throughout the state. So there's an opportunity really for anyone to be able to receive these services. We also have 5 family support groups statewide with Clifford Beers. CRT, they have 2, one of which is Spanish speaking, McCall and NAMI. And we also have our youth recovery services. I know Pam's on this call and I will not do it nearly as much justice as her. But we are partnering with DCF and Wheeler around youth recovery CT and their alternative teen addiction support for ages 16 through 24, where they're able to provide recovery support groups. And I know those are very well attended. Next, we have our justice-related interventions, where methadone maintenance, we help to support that in 9 of our DOC facilities. So people are able to get onto MOUD if they choose while they are incarcerated, and they will be able to transfer their services into the community post release. We also have the treatment pathway program, where in early screening, where if they are low crime, meaning like non-violent, maybe simple trespassing, minor, people stealing food or basic need items, substance related, that they're able to have the opportunity to potentially be deferred into programming for their substance use versus being incarcerated as a result, because we don't want to incarcerate people that just continues to make that cycle and a journey that we don't want. So our hope is that by providing these resources, they'll get the treatment that they need and they won't have to begin that incarceration process. We also have our social media campaign through liveloud.org. We are currently updating the website to make it a little more user-friendly. We also are creating little mini videos that are going to be online that really talks about what is addiction, how to support someone with addiction, knowing that many people in the community have loved ones that are dealing with this, and they either don't know what it looks like or they don't know how to help and best support. We also see that about 60% to 70% of those who have overdosed had a bystander nearby. So that means someone was in the home, someone was available to help support, and that person still had the overdose or had died as a result. So we're really pushing to get family and loved ones aware of this so that they can provide the naloxone. Because yes, we can give it to those who have the substance use disorder, but they can't Narcan themselves. So it's important making sure that those around them know how to use it and know the signs. So we're working on that, and also talking about the importance of fake pills and what that looks like and how to receive support. We have changed the script that we hope to support with, which I didn't go into detail because Tom did a great job, so there's no need there. And then I wanted to talk a little bit, because I know people have heard about the Opioid Settlement Advisory Committee, OSAC. And so here we're slated to receive over $500 million over the next 18 years through settlements. To date, we've gotten $60 million. So through this process, we've been very transparent. We have not spent any money thus far. There is a OSAC committee that represents people from multiple towns and different areas, mental health, leadership, first responders, etc., and looking to come up with different ideas of how to utilize this money. We want to make sure we're very thoughtful on how we use it. It can't be used for anything that we're currently funding, so we need to think of new innovative ways to spend this money. So there is meetings that occur, and they're all, I put the website here, but if you click on that, all the meetings are recorded. There's minutes, there's agendas, there's report outs, all of that. So you can certainly go back and look and get on the list for future meetings. And I also want to mention, I know it's short notice, but there is a portal that is open till the 17th of this month, where you can make a funding recommendation to OSAC. So if you have an idea that you think would be helpful, evidence-based is really what we're looking for, that could help support and needs maybe funding, or you think might be helpful to combat the opioid crisis that we have, you can put in a recommendation through that portal. We ask that you just put one, because they do all get read, and it's hard to read the same one 17 times. So if you could, and we will funnel it to our different committees. So there's a referral committee, there's a data committee, there's all sorts of committees, just to make sure that we're making sure that the money's being used accordingly. And they will go to our ADPC subcommittees, where there are subject matter experts, and will say whether or not they think it's a viable solution. And then that could be a potential for funding. So it's only like 2 days left, but I did want to put it in there in case there's something that you've been thinking about and just wish you had the money to be able to get off the ground. This is your opportunity. And here is all of our contact information. So you have mine, Louisa, and if you need any additional information, you have our website, and we have lots of information as well on xylazine, fentanyl, where to receive services, all of that information.
So good morning, everyone. My name is Linda Lentini. I am the Director of Healing from Within at Toivo. And Healing from Within is a program that we go on to inpatient psychiatric units, and we provide mind-body practices. Toivo is a center located on Park Street in Hartford. It's open to anyone and everyone. You can come attend any of our classes. It's based on donations. And people do not need referrals, but it's a great safe space for people to learn mind-body practices. I also do a lot of breath, body, mind. So years ago, I needed to explore my own healing. And I was introduced to Breath, Body, Mind by Darren, who used to be our executive director. 2 psychiatrists brought these practices together, and it really started to kind of affect me in a way that was different than any other mind-body practice that I had done in my past. So I have been with Advocacy Unlimited, Toivo, for about 15 years, since my son started school, and he's in college and about to graduate. So I have been doing these practices, peer support and practices, for a while, but Breath, Body, Mind is what I'm going to introduce to you today. And it is about really getting in touch with our bodies. And for any trauma survivor, someone that has had a trauma history, sometimes it doesn't feel safe to feel in your body. So these practices are very accessible. So I go on to inpatient units and I share these practices. I also go to the Clearinghouse on Wednesday night. Tonight I'm giving a plug to Pam. On Wednesday nights once a month to do a Breath, Body, Mind, an hour-long session. So I'm going to invite people to stand up. And Pam's putting in a thing about anyone's welcome to come tonight. So Breath, Body, Mind was created by Dr. Brown and Dr. Gerberg. There are 2 psychiatrists that came together, and they're married, and they did a lot of research on mind-body practices. So Qigong, gentle movement, Qigong, breath work, meditation. And what they discovered after they did 20 years of research is that this really can change the way somebody feels comfortable in their own skin and also in the world. So it's really safe for pretty much everyone. The practices I'm going to lead you through, I'm going to invite you to join me. You can do them standing up or sitting down, whatever's comfortable for you. If something doesn't feel right when I'm sharing it, please, I invite you not to do that, or wait until the next practice and see what feels right for you. If anyone is expecting, I'm going to ask you not to do the forceful out breaths. If anyone is recovering from any kind of respiratory issue, please also do not do the forceful out breaths. I'll make modifications. I'm going to invite you to do what feels right for you, because only you know what it feels like in your body. So with all that being said, I'm going to invite you to stand up. Enough head stuff. Let's get into our bodies. One of my favorite books is The Body Keeps a Score, because I truly believe our body does. And so we're going to change the score a little bit. When I came into the meeting, you were talking about preventing overdose and how you can change, what's in the medicine cabinets as we go into the holidays. Also concerns about our pets if there are some medications in the house. So I'm sure that even before that, you were talking about stuff that's kind of heavy. All of you are in the medical field, in the helping field. And sometimes we forget to take care of ourselves. So I'm going to invite you to take care of yourself. Stand up if you feel comfortable. If not, go ahead and sit down. But we are going to move our body a little bit to some music. I'm going to turn on some music, but I'm going to show you what we do first. And it's called tapping. It's not EFT tapping. It is a different form of tapping, but it is about moving energy. So we're going to tap parts of our body. I'll show you. And then we're going to tap down the sides of our legs. When we tap down the sides of our legs, please take care of your back. Only bend as far as you feel comfortable, or you can do this sitting down. And when we go all the way down, I tap around my feet, top of my toes, inside my feet, inside my ankles, inside my lower legs, in front of my upper legs. But I don't want you to have to keep looking up, so you can take care of your neck. So I'm going to put on some music. If you can't hear me, please unmute. Say, I can't hear you. Let me turn on some music. I'm going to invite you just to move a little. Just move your body. Tap one side of your body. Other side. Under your collarbone. Base of your neck. One of your shoulders. All the way down that arm. Clap your hands. Inside your arm. Other shoulder. All the way down that arm. Clap your hands. Inside your arm. Our amazing tummies. Outside of your legs. All the way down the outside of your legs. Outside of your feet. All the way around your feet. Inside your feet. Inside your lower legs. The front of your upper legs. Our lower back. Your kidney area. Back to one side. The other side. Under your collarbone. And dance. Or any movement that you want to. Just move your body. You could spin around. Come to stillness, close your eyes, and notice. Notice your breath. Notice your thoughts. And notice how your body feels. And open your eyes. So that type of tapping moves energy. So our organs, they say that certain feelings are in our organs. This helps our lungs as we go into cold and flu season. This helps with our immune system. Around the outside of our legs just helps with our long life. So all of the tapping is really effective, and you can put on your favorite song and tap. So that's also a very good energizer, because a lot of us give so much of ourselves that sometimes at the end of the day, we don't have enough energy for ourselves to take care of ourselves. So anytime that you want to energize, put on some music and tap away. We're going to do another one called a heart ha. So, and this is really about getting in touch with our heart. So I'm going to invite you to put your hands on your heart, close your eyes, and ask your heart what it needs. Now keeping your hand on your heart, your hands on your heart, you can open your eyes. I'm going to show you the movement we're going to do. So I'm going to invite you to draw in what you need into your heart. And then send out, with love and kindness, some love and kindness with a nice long out breath to one another. And then to our families and friends, then to where we live, and then to the world in general, because there's a lot going on in the world. We want to send as much love and kindness as we can. If you have nothing to give to anyone else, just keep bringing that into yourself and replenish all the energy around your heart. But make sure that you're drawing in what you need first, okay? So you can take your hands off your heart. You're going to breathe in, drawing in what you need. Breathing out with a long out breath, sending love and kindness to one another. Breathing in, drawing in what you need. Breathing out, sending love and kindness to one another. Breathing in. Now to our family and friends. Drawing in what you need, now sending out love and kindness to the world. Breathing in what you need, sending out love and kindness to the world. 2 more times. Breathing in what you need, sending out love and kindness to one another. Last time, drawing in what you need, sending out love and kindness to one another. Gather all of that, bring it into your heart. Again, closing your eyes. And notice. Keeping your eyes closed, releasing your hands down by your side. And again, notice. Notice your body. Notice your breath. And notice your thoughts. And open your eyes. So the sequence of practices are in a row on purpose. And the moments in between each practice is just as important as the practice itself, because in our lives, we go from one thing to the next, to the next, to the next, without ever stopping to pay attention to how we feel after something. So I really encourage you that if you do any mind-body practice, and it doesn't have to be this, whatever you do, stop and see how it feels inside of you. It doesn't have to feel the same way inside of one person compared to the other. If it makes you feel good, then keep doing it. If it doesn't, find a different mind-body practice. I spent a number of years trying to find one that worked for me, and these are the ones that work for me, but they're not for everyone. We're all really, really stressed. So finding ways that you can unplug from your thoughts and how your body might be feeling is really important for your long life. So that heart ha is not for everyone, but it is important before we do the next practice. This is a very calming practice because we're extending the out breath. We want the out breath to be a little longer than the in breath, because the out breath being longer will calm us down quickly. And in breath being longer will give us energy. So our breath, the healing power of the breath, is so vital to everything that we do that if we didn't have it, we wouldn't be here right now. We can also use it to our advantage when we need energy, when we don't need so much energy. So I'm going to show you a practice. This is 4-2-4-2. It's a great calming practice. And this is something you could use if you feel like you're getting really nervous about something, or you're carrying a lot of tension and you want to relieve that tension. If anyone's expecting, please don't do the holds, because the holds are not good for a baby. We just don't want to restrict any kind of oxygen getting to the baby. So You're going to stand with your feet comfortably shoulder width apart. I'm going to show you the movement. I'm going to encourage you to join me. What we're going to do is we're going to start with our palms facing up, a little below our tummy button. And we're going to start with 2 sighs together, taking a nice breath in, breath out with a sigh. And after those 2 sighs, we're going to breathe in for the count of 4, hold for the count of 2, breathe out for the count of 4, and then hold for 2. If this doesn't work because your shoulders bother you, just breathe in where it feels comfortable, stop, and then breathe out. If the movements don't work at all, just do the breath. The breath is the important part of it. So join me if you want. Palms facing up, a little below your tummy button. Let's take a nice breath in. Breath out with a sigh. Another breath in. Breath out with a sigh. Breathing in. 2, 3, 4, hold, 2. Breathing out. 2, 3, 4, hold, 2. Breathing in. 2, 3, 4, hold, 2. Breathing out. 2, 3, 4, hold, 2. 2 more. Breathing in. 2, 3, 4, hold, 2. Breathing out. 2, 3, 4, hold, 2. Last one. Breathing in. 2, 3, 4, hold, 2. Breathing out. 2, 3, 4, hold, 2. And close your eyes if you have your eyes open, or just look down at the ground, really focusing in on yourself, and not external things, but internal. Notice how your body feels. Notice your breath. And notice your thoughts. And open your eyes. So if anyone's still standing, I'm going to invite you to go ahead and have a seat. Coherent breathing is the core of breath, body, mind. And coherent breathing is where we're balancing our nervous system. So we're not in fight, flight, or freeze. We don't have too little energy. We don't have too much energy. We just have enough. And that's what we're trying to be coherent in our life. I want to show up in my life where I'm focused yet relaxed. That takes a little bit of work. So we're going to breathe in the same rate as we breathe out. 6 seconds in and 6 seconds out. And this allows us not to be in fight, flight, or freeze, or in too little energy. We just want to be coherent with life. So we're going to do a little bit of that. And I know we have to end at 11:30. So I will make sure that you are done by that time. I'll make sure that we don't go over. So let's start off by taking a nice breath in. Breath out with a sigh. Another breath in. Breath out with a sigh. And if you feel comfortable, close your eyes. If not, just lower your eyes. Lower your eyelids. I'm going to start to soften your muscles, inviting you just to soften. The muscles in your forehead, around your eyes, and in your face. the muscles in your neck, in your shoulders, and in your arms. Soften the muscles around your heart, in your tummy, and in your legs, and in your feet. And check in with your entire body. Where can you soften? Slowly lower the tones. And I'm going to put on some piano notes. And with the piano notes, I'm going to pace your breath. And this is where we're going to get the coherent breath rate. You don't have to do anything besides just follow the tones, the piano notes going up and the piano notes going down. And I'm going to give you direction as we go along. So breathing in, 2, 3, and out, 2, 3. Breathing in, 2, 3, and out, 2, 3. Breathing in, 2, 3, 4, and out, 2, 3, 4. Breathing in, 2, 3, 4, and out, 2, 3, 4. Here comes the piano notes. Breathing in as the notes go up. Breathing out as the notes go down. Gently breathing in. Gently breathing out. Breathe in, filling your belly with breath. As you breathe out, releasing breath from your belly. Gentle breath in. Gentle breath out. Breathing in. As you breathe out, softening your body a little bit more. Soften. Bringing energy into your body as you breathe in. And softening a little bit more as you breathe out. If you're distracted by anything, just reconnect to the breath as you breathe out. Deep breathing in, softly breathing out. continuous breath in. Smooth, continuous breath out. Breathing in softly. Breathing out gently. I fade the tones, allowing your breath just to return to whatever pace feels comfortable for you. And keep your eyes closed. Just rest. Just for half a minute. Not worried about anything you have to do next. I'll make sure to end so you have a minute to spare. I fade the music, becoming aware of your surroundings, listening to the noises, feeling your feet on the ground, maybe stretching like you're waking up from a mini nap. And if you haven't already, go ahead and open your eyes. So thank you everyone for allowing me to take some of your time and share practice with you. If you want some more information, I'm sure Sheila can send some information on how you can contact me. All the classes that we offer at Toivo are free and they're based on donation. You don't have to pay anything. You don't need to have anyone have a referral. And I do a lot of classes online at no cost. So I hope everyone got something out of that, or at least had fun watching me dance. So thank you, everyone.
Thank you, Linda. That was wonderful. And I think this is the first time I was able to do that with you. And I've heard such wonderful things. And so it was really, really great. And I think I can speak for everyone that after a really great and informative meeting, it was also really helpful to kind of just wind ourselves back and ground ourselves.